New Mexico Cancer Center and Health Specialist of New Mexico are the proud sponsor of health and wellness on New Mexico Living.
Doctor, let's talk about prostate cancer patients. Do you see them, and what should viewers know about screenings?
Yeah, absolutely. I do see a fair number of prostate cancer patients, and what I will say is that the best way to screen for prostate cancer is to get a PSA level. It's a blood test. Oftentimes, your primary care provider will get as part of the annual lab work, and it gives us kind of an early detection system for possible concern for prostate cancer.
And speaking of early detection, that's what everybody wants if they're getting diagnosed with cancer, right? Let's talk about how prostate cancer can possibly be detected in the early stages by using MRI-guided biopsies. Talk to me about that.
Yeah, absolutely. So when I'm seeing a gentleman for elevated PSA, one of the things that I will talk to them about for further diagnosis is to get an MRI of the prostate. It's basically a non-invasive way for us to see, are there any spots in the prostate that have a high chance of being cancer? Now, when we move to diagnosis, the only way we have for diagnosis currently is to do a biopsy of the prostate, getting pieces of tissue from the prostate. At New Mexico Cancer Center, we have the technology available where we can take the MRI image that you had before, merge it with the real-time ultrasound that we're using at the time of biopsy, and specifically targeting the spot or those spots that we found in MRI to hopefully get us a better chance of finding the cancer. And I will say that once we have made a diagnosis, myself and my partners, depending on a patient's risk factors, we have the ability to offer surgery for prostate cancer. My medical oncology colleagues down the way from me, they have the ability to treat with clinical trials or immunotherapy, and we also have radiation oncologists in the building who can help with radiation therapy. So I guess the point I was trying to make is that under one clinic, we have the ability to kind of meet all the needs of our prostate cancer patients.
For all the stages that they're going through, which is very, very important. Last but not least, is there anything our younger male viewers should know when it comes to cancer screening?
Absolutely. The one thing I always make sure to tell my younger patients that I'm seeing for whatever reason is that it's super crucial in order to screen for testicular cancer to do a self-examination of your testicles at least once a month. The way I kind of frame it is do it while you're in the shower and you have easy access. What I say is feel each testicle. A normal testicle should feel like a hard-boiled egg with the shell peeled off. And when you're trying to feel for are there any lumps, bumps, pebbles, or marbles inside that egg that shouldn't be there, if you do find something that is new, concerning, talk to your primary care doctor and see if you would benefit from talking to your urologist.
Really important, those self-exams that you can do on your own. Do them once a month, you said. It's really quick, really simple. Dr. Ron Cheng, urologist, health specialist of New Mexico, thank you so much for joining us today. A lot of great information.
You're welcome. Thanks so much for having me.